Hello, everyone. My name is Jake McKell.
And I'm Amanda Flanagan.
We're with the PROTECT study. Today, we'll be looking at incidence of COVID-19 infection in Utah children during the Delta and Omicron circulation. So here's a brief overview of our poster. These are the figures we'll go through and some of the things we'll talk about. Just to give a brief overview, we're going to go first over a map looking at where our participants are concentrated here in our Utah cohort. We'll also talk about some of the demographic stats and positive cases during Delta and Omicron.
So our introduction being children remain an understudied population regarding SARS-CoV-2 and COVID-19 trends, exposures, and vaccine effectiveness. Our objective is to describe a prospective cohort ages 6 months to 17 years and detail COVID-19 trends within that population. For methods, pediatric research observing trends and exposures in COVID-19 timelines, aka PROTECT, is a multi-site prospective cohort study monitoring symptomatic and asymptomatic SARS-CoV-2 infections among participants aged 6 months to 17 years. The study date is from October 1st to 2021 to February 28th, 2022. Though this is a multi-site prospective cohort, our poster is just specifically looking at the Utah cohort, but statistics were run using odds ratios with 95% confidence interval. Looking at the first figure, this map details where many of our participants are concentrated within our boundaries. Our boundaries being Salt Lake, Davis, Utah, Summit, Morgan, Weber, and Tooele County. As you can see, most of our participants are located in the Salt Lake and Utah County area.
So here's a quick breakdown of vaccine status according to demographic factors. I'll just go through the totals really quick of each vaccination status within our population. We had 20 partially vaccinated as of February 28th. We had 98 fully vaccinated, 2 boosted with a booster shot, that is, 145 unvaccinated, and 11 with an unknown or unconfirmed status. That gives us a total of 276 children in our Utah cohort. Here's a graph looking at new positive tests each day as a percentage of the study population. As you can see, this blue arrow here indicates the first Omicron case detected in Utah. That was on December 3rd, 2021. As you can see, we saw quite a few more positive cases within our cohort during Omicron circulation. I'll go over the specifics of that next in the results section. Prior to the first case of Omicron variant in Utah, daily SARS-CoV-2 positive tests did not exceed 1.36% of our cohort, but during Omicron predominant circulation, infection numbers reached as high as 5.75%. That was on January 18th, 2022. Fortunately, to date, there are no hospitalizations or deaths in the Utah cohort, which is wonderful. Few of the demographic results of the factors observed, ethnicity was actually the strongest predictor of whether a participant was fully vaccinated. Those who identified as Hispanic, Latino, or Spanish origin were 72% less likely to be fully vaccinated, while those who identified otherwise were 4.67 times more likely to be fully vaccinated than partially or vaccinated or unvaccinated. Children who were enrolled in in-person school were 64% less likely to be unvaccinated, while those who were not enrolled in in-person school or daycare were 2.27 times as likely to be unvaccinated than vaccinated at all. That was run controlling for age, as those who are 5 or younger would not be enrolled in public schools, nor would they be eligible for vaccination. So this statistic was run excluding those younger than 5.
So our 3 main conclusions being that there was a significant rise in pediatric cases of SARS-CoV-2 during the Omicron circulation versus the Delta circulation. Ethnicity and in-person school attendance were the best predictors of vaccination status, with identifying as Hispanic, Latino, or of Spanish origin and not attending in-person school, making children less likely to be vaccinated. And finally, that understanding the spread of COVID in children is essential for a complete understanding of the pandemic. Here are some of our acknowledgements.
Here are a few of our references. If you have any questions, please feel free to reach out to me at the email you see above, or to the PROTECT study in general at protectstudy@utah.edu. Thank you all for your time and have a wonderful day.